And we're going to pick up at fruits. I can't hardly say fruits that well, so it's fruits. Fruits. So are fruits okay to eat if you're diabetic?
They are okay to eat. You just have to count them in your carbohydrate servings.
Mm-hmm.
So you want to spread them out throughout the day. You know, don't eat a large amount at one time, just like any carbohydrate. Some fruits have more sugar content than others, like bananas are going to be higher in sugar, are higher in carbohydrates. So you do want to take that into account. And I'm not telling people not to eat bananas. Just take that into account. You have to balance it and know that it is going to have more carbohydrates than some other fruits.
Mm-hmm.
And just experiment, not even just with fruits, but all types of foods. Some will raise your blood sugar higher than others.
Mm-hmm.
So if you know when you eat a banana, you can't get your blood sugar to go down later, you know for next time to eat a smaller amount.
Mm-hmm.
I have had patients who have told me in the morning they can't tolerate fruit because in the morning it really spikes their blood sugars higher. But if they eat it later on in the day, then they're okay. So for them, it's best for them to eat high protein foods like
Mm-hmm.
eggs and meat
Mm-hmm.
for breakfast instead of having fruit and cereal.
Mm-hmm.
So those are things as a diabetic that you want to take into account how your body responds to things.
Right, right. So you must do your testing, do
Mm-hmm.
some trial and error.
Yes.
When you eat something like a certain fruit, a banana or maybe an apple, you can probably take your blood sugar later and see how it affects you.
Mm-hmm.
You can probably take your blood sugar later and see how that affects you after eating a certain fruit.
Right. And you
Okay.
want to wait about 2 hours
2
after
hours.
to check.
Okay. What are some good foods for people with diabetes?
For your snacks, you want to make sure you have something with protein. The good thing about, and a good fat, and or a good fat, the good thing about those is they help to stabilize your blood sugar. They help you to feel satisfied longer, so you're not getting hungry as often and just continuing to graze. So some examples of that would be like a half sandwich or a low-fat cheese and a few crackers. Cut up vegetables like celery, carrots, peppers with hummus, even plain yogurt and some fruit, a small handful of nuts. Those are going to be things that are going to keep you satisfied for longer and keep your blood sugar stable.
So did you say like snack more often, but choose?
I wouldn't, you don't want to snack too often. The recommended amount of time in between your food is about 4 hours. So I wouldn't go longer than 4 hours without eating. If you do need to go longer between your meals, then make sure you have that snack at the 4th hour.
I see you said peanut butter, so peanut butter is okay with crackers.
Or fruit.
Okay. What is the recommended daily intake for carbohydrates and sugars?
So when we're looking at the intake of carbohydrates, we want to really look at it more as a dose instead of daily, because it's that amount at one time that's going to put the stress on your pancreas. So it's trying to, get the insulin out based on what you just ate. So and it's going to be different for each person depending on your weight and things like that. But generally speaking, we recommend 45 to 60 grams per meal. For most women, it's going to be 45 grams, men upwards to 60. So that's per meal. And then for a snack will be 15 to 30 grams of carbohydrate.
And I didn't know that. Most people seem to think, okay, what is that dietary intake, that recommended dietary intake for the full day? But it's per meal. So that gives us, we need to be proactive in figuring out our foods and how many carbohydrates and sugar is per meal.
Right.
That's good. Are artificial sweeteners safe? And do you suggest any specific artificial sweeteners?
And one thing you probably know about me from previous segments is I'm not really for anything artificial as far as putting it in my body. So I feel like they are probably reasonably safe. Otherwise, I would hope our government would outlaw them if they were not safe for us.
Mm-hmm.
But I personally do not consume any. I would recommend natural forms of sugar like honey, real maple syrup, molasses, things like that. Stevia is actually a low calorie or no calorie natural sweetener. I think it's a little bit more processed than the other ones that I named, but those are some that I would recommend. I've also used sugar in the raw or raw sugar, just very sparingly. It's going to be the same sugar content, but it has a little bit more of the molasses in with it, so you get a little bit more minerals with it.
What about beet sugar?
Yeah, you can
Beet
use
sugar
it.
as well.
Mhm.
Okay. Can type 2 diabetes be reversed?
Yes, it actually can be reversed for some people. Many people who've had the weight loss surgery, after they've lost a significant amount of weight, they no longer have diabetes. So yes, it can be reversed. It just depends on the person, how severe their diabetes is, and how dependent they are on insulin. And one thing to note is Halle Berry actually has type 2 diabetes, and she got herself off insulin. And doesn't mean she's no longer diabetic, but even if you can't reverse it, you can decrease your dependence on insulin.
Okay. Now we're going to go into weight loss. So why is weight loss important for people with type 2 diabetes?
It's tremendously important if the person is overweight. It helps to decrease your insulin sensitivity, so it basically helps to get that insulin to work better, to get the sugar out of your blood and into those cells for energy where they belong. Sugary, sticky blood just doesn't move very well, and that's what I tell my patients. If you put a lot of sugar in Kool-Aid, you know how it gets real thick and doesn't move very well, or is slower. That's the same way it is in your body. When your blood sugar levels are high, that blood is not moving very well. It's saturated with sugar, and that is what causes problems with your perfusion, your blood circulation, that can lead to amputations, slow healing, can lead to dialysis and things like that, because that blood is not moving the way that it should.
Okay. So can you expand a little bit more about the weight loss and, how that will, what we need to do as diabetics to, what type of exercises or what type of exercise program you would recommend?
Sure. With the weight loss, it's mostly going to come from the food first. The exercise is beneficial. When you exercise, it makes your insulin 50% more effective. So you do want to have exercise incorporated. A lot of times, if people are having problems with their blood sugar after their meals, I will recommend that they take a nice walk after meals to help to get their blood sugar more tightly controlled. But as far as effectiveness, getting your nutrition under control is going to be most effective for your weight loss. And then the exercise is just an added benefit to make you less insulin resistant.
Okay. Wonderful. So first of all, we need to change our eating and watch our carbohydrates and our sugar and make wise choices, and then add that exercise to get that sugar out of our blood.
Right, exactly.
Okay. You mentioned something about pre-diabetes in the previous section. I guess that was like the insulin resistance.
Yes.
What would be the signs of a person that they may experience who are pre-diabetes?
They could have no symptoms at all, or they could have symptoms similar to someone who has diabetes. So they could have increased urination, thirst, headache, difficulty concentrating, low levels of energy. But if they have any of those symptoms, they definitely want to get checked.
Exactly. So listeners, again, like I said, we was going to run out of time about diabetes because there is so much to talk about. So just check in with us next time, next Wednesday at 4:45 p.m. to tune in a little bit more, for a little bit more information about diabetes. There's so much information out there, and we want to enlighten everyone out there about that. So if you have any questions, you can always give us a call at 314-524-3958, or you can reach Leka at.
You can reach me on Facebook at facebook.com/Coach Leka, Laka.
Okay, you guys, thanks for tuning in. Tune in next time. Have a good evening.